Thank you all. A few updates, and then I'll introduce Dr. Deborah Birx to talk about what we're seeing around the country, what the data is telling us. But suffice it to say, as the President said several times, this is a very tough week in America. And our hearts go out to all of the families that have lost loved ones to the coronavirus. But I know I speak for the entire White House coronavirus Taskforce when I say our hearts are with the people of the greater New York City area today. As we stand here today, in the midst of heartbreaking numbers of losses in New York City, I also want to assure the American people that there's reason for hope. As Dr. Birx will enumerate in just a few moments, despite the increase in losses, as Governor Cuomo articulated today, hospital admissions continue to decline. And in our report early this morning from Dr. Birx, we continue to see evidence of stabilization in some of the areas around the country of the most significant outbreak, the New York metro area, including New Jersey, Long Island, and Connecticut, New Orleans metro area, Detroit, Boston, Chicago, and Denver, as Dr. Birx will explain, continue to give evidence of stabilization, which in a very real sense is evidence that the American people are putting into practice the social distancing, the President's guidelines for our nation. And for that, as the President said earlier today, we thank the American people. Even in the midst of hardship and loss at a time when we've seen more than 385,000 Americans test positive for the coronavirus and more than 12,000 succumb to this illness, the evidence that Dr. Birx will describe to you will show that the American people know our future is in our hands. And so as I begin, allow me just simply to continue to urge every American to put into practice the guidance you're receiving from your state and local authorities. Take it to heart, take it seriously, share it with your family and your friends, and know that you're making a difference, America, because you truly are. Today, for my part, I spoke to over 500 small business owners in a conference call, and there I heard about their enthusiasm for the Paycheck Protection Program. And that call took place before the President had the Secretary of Treasury indicate our interest in acquiring another $250 billion for that program. As of this morning, more than $60 billion in forgivable loans that would cover 2 months of paychecks at small businesses had already been distributed, and the number is going to grow literally by the day. We also had a very productive call today with some other American heroes. You know, we all have in our hearts and in our minds our healthcare workers, and I'll speak for a moment about the supplies and resources that we're working to provide for all of them. But right below our healthcare workers are all the people that are working in critical infrastructure around the country, and some of the most important people are working in food supply. I mean, from the farmers and the ranchers to our processors, to our distributors, to our truckers, to our grocers. Americans are keeping food on the table for our fellow Americans. And let me begin by just saying what I said to some of the most prominent CEOs of meat and grain industry companies in the country, companies like Tyson Foods and Hormel today. Not just these companies, but to all the hardworking people working in food supply today, thank you. Thank you for what you're doing to keep those grocery store shelves stocked. Thank you for showing up for work every day and working hard to keep that food supply rolling in America. You know, it was more than 5 weeks ago that the President brought in all the grocery store leaders in the country, and there he received a commitment that no grocery store in America would close, and they haven't. But it's been these heroic Americans, from the farm to the fork, that have made it possible for Americans to have one less worry, and they are truly inspiring heroes. That being said, I did hear from the industry today that there have been reports of some plants having reduced capacity because of people having concerns about exposure to the coronavirus. In fact, over the last several days, there's been some incidents of worker absenteeism, and some plants have actually been forced to close temporarily. And so on behalf of the President, on behalf of our entire team, and on behalf of a grateful nation, let me just say to all of you that are working in the food industry at every level across the country, just understand that you are vital. You are giving a great service to the people of the United States of America. And we need you to continue as a part of what we call our critical infrastructure to show up and do your job, and know that we're going to continue to work tirelessly in working with all of your companies to make sure that that workplace is safe. With that being said, let me talk about the other heroes that we always mention at this podium today, that Dr. Birx and Dr. Fauci invariably mention, and that's our healthcare workers. At the President's direction, we've been working tirelessly, literally around the clock, to identify resources around the country and around the world to make sure our healthcare workers have the support that they need. With some 51 major disaster declarations, most recently Minnesota being approved, states have stood up 27,000 National Guard, but personnel-wise, before the end of business today, there will be more than 3,000 Department of Defense and Health and Human Service medical personnel on the ground in the greater New York City area. And those people will be redeployed once that region of the country moves through the coronavirus epidemic in that area. And we salute those extraordinary patriotic Americans for stepping forward to bring real relief to our healthcare workers. With regard to equipment, Admiral Polovchek reported to the task force throughout the course of the day today that we have continued to distribute ventilators across the country. We're sending additional ventilators from the Strategic National Stockpile. Maryland will receive 50 ventilators. Delaware will receive 50 ventilators. And that will leave more than 8,400 ventilators still in the national stockpile. One correction from yesterday. After our press briefing yesterday, FEMA made a different decision with regard to what the state of California generously made available. And the ventilators, some 500 ventilators that we again want to thank Governor Gavin Newsom and the people of California for donating to our nation's efforts. 100 of those are being deployed to New York, 100 to New Jersey, 100 to Illinois, 50 to Maryland, 50 to Washington, D.C., 50 to Delaware, and 50 to Nevada. With regard to the remainder of what we call personal protective equipment, again, we've been literally leaving no stone unturned anywhere in the country, anywhere around the world. And as Admiral Polovchek described just a couple of days ago, we've established not just an air bridge, but a control tower system modeled after military logistics out of FEMA. And while FEMA is acquiring a small portion of what's being acquired, 90% of the supplies are being routed directly into our massive distribution system. And FEMA is using the data that Dr. Birx provides to target those resources to the areas most in need. I asked them to break out a few details about resources that just in the last 5 days have been distributed, and I hope it's an encouragement to healthcare workers all across these regions and around the country about the efforts that are being made to make sure they have what they need. You can see the New York metro area, including New Jersey, just in the last 5 days, more than 6 million N95 masks, more than 6 million surgical masks. When Governor Cuomo and I last spoke, he told me there was a real challenge for medical gowns in the New York City area and in New Jersey as well. And 2.8 million gowns were distributed to that region as well. Going next to New Orleans, where again, while we see some encouragement, challenges remain in that community. Some 837,000 N95 masks for healthcare workers, 165 surgical masks, other items including almost 6 million gloves have been distributed. Detroit continues to be a real focal point. We're working closely with Governor Gretchen Whitmer as well as Mayor Mike Duggan to meet the needs of healthcare workers in Detroit. Just in the last 5 days, 1.6 million N95 masks have been routed into the healthcare system in Detroit, nearly 700,000 surgical masks, and 24 million gloves, just as a portion of what's displayed. And in the Chicago metro area, which we continue to focus on each and every day, more than 1.7 million N95 masks have been routed into their healthcare system, 900,000 surgical masks, 25 million gloves. I share these details in the hopes that healthcare workers looking on will be encouraged. At the President's direction, we are making every effort to make sure you have the resources you need to do your job, to do it safely, and to go home safe to your family, even while you provide that extraordinary and courageous care that our healthcare workers are providing literally around the clock in the midst of the coronavirus challenge. The last slide is just the cumulative numbers that we have distributed, and I'm happy in a few moments to answer any questions about that. Again, the system that we have in place is one that is essentially infusing our major distribution networks with millions of items, and then FEMA is directing on a day-by-day and oftentimes hour-by-hour basis where those resources are most needed. And we'll continue to do that as the coronavirus makes its way through these communities and through communities that are very much on our watch list today. Let me just lastly say that, again, I want to thank the American people for stepping up and doing your part. We continue to be overwhelmed with one story after another, where people are doing social distancing, where people are looking after one another, where they're checking in with a phone call to an elderly friend, a family member, to make sure they're okay. I mean, we are on the front end of 30 days to slow the spread. And I will tell you, as a non-scientist up here, that I see glimmers of hope in the early numbers that we're seeing come out of the greater New York City area, New Jersey, even New Orleans and Detroit and Chicago. There does appear to be, as Dr. Birx will explain in more detail, there does appear to be evidence of leveling, evidence of progress. But this is exactly the time for all of us to redouble our efforts to do everything each and every one of us can, not just to protect our own health and that of our family and our loved ones, but to do our part to ensure that we lessen the impact of the coronavirus on America as a whole, but even more importantly, that we lessen the impact on lives by ensuring that we do our part to make sure that no one that is vulnerable is unnecessarily exposed to this virus. With that, let me yield to Dr. Birx and then Seema Verma and Dr. Fauci, and we'll take all your questions.
Thank you, Mr. Vice President. So hopefully you can see from those numbers that we've taken a data-detailed approach, really bringing the power of granular data to the supply chain and moving supplies based on really what you would call burden of disease and need. If I could just start out by not just going to the numbers at the beginning, but really talking to the community of health advocates, to the community that works on the social determinants of disease and the communities of the historic Black colleges and universities. We really need to improve messaging, and I'm asking them to help us increase the messaging around this. We don't want to give the impression that the African American community is more susceptible to the virus. We don't have any data that suggests that. What our data suggest is they're more susceptible to more difficult and severe disease and poorer outcomes. And we really need to make sure that every household is aware of what it's going to take to protect the individuals in that household that have pre-existing conditions. We could call on the indigenous nations, the real tribal leaders, to also be working very closely to protect the elders of their communities. We know this is more difficult in multi-generational households, and it's really going to call for really unbelievable attention to details of hand washing and protecting others from each other, particularly if you don't feel well. This is really a call to action to the communities to make sure that we get messages appropriately out there so that everyone understands what it's going to take for us all to protect one another. And we know it can be done because we can see these changes. I wanted to go through the numbers at a high level so you understand why particularly these supplies went to these areas to begin with. We talk about attack rates or the cases per population. So in the New York, as a state, they have 7 cases per 1,000. This is the highest in the country. In New York City itself, it's closer to almost twice that in New York City. New Jersey is 4 per 1,000, Louisiana 3 per 1,000, Massachusetts 2 per 1,000, Connecticut 2 per 1,000, Michigan 1.5 per 1,000. The District of Columbia and the Baltimore area now 1.5 per 1,000, and we're watching them very closely. Pennsylvania 1 per 1,000, but we're concerned about Philadelphia. What is allowing us to move supplies based on burden of disease and need is the extraordinary West Coast that has had very low numbers, from Washington that was less than 1 per 1,000, California that is less than 0.5 per 1,000, and Oregon that's even less than that. And it's those states where there's large populations, because of the enormous work that they're doing to prevent expansion and spread of the virus. It's allowing resources to go to these states and these communities and these counties that need more support. And so this kind of data analysis is allowing us to make very intelligent decisions about need, but also really understanding what's happening across the country in the development of the curves, as you have heard about. And so we do see, and I know you heard me caution that over the weekend sometimes there's decreased case reporting, and so there were increases in a series of communities on Monday. We're seeing that stabilize again, and when you look over 3 days, you're starting to see that we may be actually in a series of communities outside of New York and New Jersey and Connecticut creating a much flatter graph. A much flatter curve. So you saw New York and the increase, and then you saw, we're hoping, as Governor Cuomo and the mayor has described, that they're getting to a steady state where the next outcome is going down. But we see across the country, in Detroit, in Chicago, some real, not this extreme going to 7 cases per 1,000, but really staying in the more 2 cases per 1,000 and a different curve parameter then. And it really shows the amazing, amazing activity of every American in those cities to really ensure that there's social distancing, and really importantly, to ensure there's less socialization between households, and really ensuring that the household really remains independent and protected, and not really at this moment going out into the community or socializing anywhere but a virtual way on computers, by Zoom, by FaceTime. And I think we can really see that in the data, and it's really given us great heart. I want to finish by really talking to my laboratory directors, because you're extraordinary and you've done an amazing amount of testing. Those nearly 2 million tests that we're getting to, those were all done in the last 2 to 3 weeks. But we do have excess capacity. So if all the lab directors could look in their laboratories, if they have an Abbott M2000, if they could get that up and running, we could double the number of tests that we're doing per day. That is a high throughput. The machines are throughout the United States. There's hundreds of them. Right now, about 80% of them are idle. We're going to have a call with the laboratory directors of these laboratories to really ensure this is an automated, robotic situation that they can run. There's over 1 million tests sitting, test kits sitting, ready to be run. We have 5 platforms of tests. This is one of our really high volume platforms, like Roche, and we're really calling on them to really increase that capacity so that we can do not only increased diagnostic testing, which I think we're doing quite well right now, but also increasing the ability to do more healthcare workers, first responders, community testing, and surveillance. And then finally, you will see, and you've heard about it happening in the UK and other places, There's a series of antibody tests out there that have not been validated. We're working right now very closely with a series of companies that know how to make these tests, that have made these tests for us for decades, for HIV, for a rapid test. They're working on that technology to bring that quality of test, which is in the 90+% sensitivity and specificity, to the American people for antibody tests. But until we get those, if you see them on the internet, do not buy them until we can give you a test that's reliable for all Americans. And we are working very hard to have that happen and bring that to the American public. Some of the tests that may be available on the internet may have very low sensitivity and specificity and give you a false reassurance that you either give you a false positive or a false negative, implying that you may be protected. So please wait until we have those tests available and validated. People are working around the clock to make those available to the American people. We all understand how important that is because you've heard us talk about asymptomatic cases, and we really want to know how broad that is and how common that is. And so in places like New York City, where I described that they had a 7 per 1,000, sometimes 2, 3, and 4 times any other place in the United States, being able to know what the number of people who never had symptoms but do have a positive test would be really critical at this point, particularly as we plan for any reoccurrence in the fall or in future seasons. Thank you.
Great. And we have Seema Verma, Center for Medicaid and Medicare Services, will discuss what we've done to support hospitals. As we support healthcare workers, we want to make sure the institutions that are providing the environment for care are well-financed, and she's got a couple of funding streams, and help is on the way. Seema?
Thank you, Mr. Vice President. And let me just start with echoing the President and the Vice President's comments about our condolences to all the people out there that have lost somebody to the coronavirus. And also, sincere appreciation and thanks to all our healthcare workers that are on the front lines. But we know that it's the impact on the healthcare system isn't just those frontline workers. Healthcare organizations across the nation are having increased expenses. They're having to spend more on supplies. You're seeing all of the supplies that are being sent to them, and that's having a direct impact on their bottom line. Many of them are also having increased expenses because they're taking advantage of some of the flexibilities that we've given them. Hospitals without walls, they're putting, you may see tents out in their parking lots where they're doing testing or screening, so they have a lot of increased expenses as well. Other healthcare organizations are not performing essential surgeries or other services. A lot of them are moving to telehealth, and that represents lost revenue for these healthcare organizations across the country. And so the President has asked us to address this issue. About 10 days ago, we put out something called accelerated payments that we do in the Medicare program, and it allows us to advance payments to providers based on their historical Medicare revenues that they receive. So just in 10 days, we've been able to provide payments to providers. We had about 25,000 requests. We've processed about 70% of these. It's happened in about 5 days, and the total on that is about $34 billion that we've managed to put into the healthcare system. But those are essentially loans. The President has asked us to go further with this and to start the implementation of the CARES Act. That provides $100 billion to the healthcare system. You've heard Secretary Azar talk about the focus on some of those dollars going towards the uninsured, but the President wants us to accelerate getting those dollars out. And so this week we will be putting out another $30 billion, which are grants. This is going to be based on Medicare revenue. There are no strings attached, so the healthcare providers that are receiving these dollars can essentially spend that in any way that they see fit. Also, this is going to be done in a very easy, simplified way for many of our healthcare providers. We actually do direct deposit with them, and so those dollars will just go right into their bank accounts. For other providers, all it's going to require is some very simple registration, and we'll be able to give them that money as well. So we're expecting that to happen this week. The other thing to note is that this is not a first-come, first-served basis. Because we are basing this on their Medicare revenue, they will get these dollars. So even if it takes a few days, there shouldn't be any panic in the system as well. The other thing to recognize here is that our priority was on getting these dollars out as quickly as possible. We heard that from the many healthcare providers across the country that weighed in on this. They said the most important thing was to get these dollars out as quickly as possible. But we recognize that in terms of getting these dollars out, because it's based on Medicare revenues, there are providers out there, pediatricians, children's hospitals, OBGYNs, even our nursing homes, that a lot of their revenue comes from other sources, Medicaid or other payer sources. And so those organizations will be addressed in the second tranche of funding, and we'll have a priority for these organizations and these types of healthcare providers. Also just want to say, so together between the loans that we've put out there with our accelerated payments and the $30 billion, that's about $64 billion for the healthcare system this week alone. And so I think, again, this is part of our effort to support the healthcare system, and also just want to, again, say thank you to all our healthcare providers out on the front lines. To all Americans, the best thing that we can do to support our healthcare providers is to adhere to those guidelines around 30 days to slow the spread. That is the best thing that we can do to support our healthcare workers. Thank you.
Dr. Fauci, please.
I just want to make a brief comment to get back to the discussion about the health disparities in the African American community, because it really is very important. And the reason I want to bring it up, because I couldn't help sitting there reflecting about sometimes when you're in the middle of a crisis like we are now with the coronavirus, it really does have ultimately shine a very bright light on some of the real weaknesses and foibles in our society. And as some of you know, the greater proportion of my professional career has been defined by HIV/AIDS. And if you go back then, during that period of time when there was extraordinary stigma, particularly against the gay community, and it was only when the world realized how the gay community responded to this outbreak with incredible courage and dignity and strength and activism, that I think that really changed some of the stigma against the gay community, very much so. I see a similarity here because health disparities have always existed for the African American community. But here again, with the crisis, how it's shining a bright light on how unacceptable that is. Because yet again, when you have a situation like the coronavirus, they are suffering disproportionately. As Dr. Berg said correctly, it's not that they're getting infected more often, it's that when they do get infected, their underlying medical conditions, the diabetes, the hypertension, the obesity, the asthma, those are the kind of things that wind them up in the ICU and ultimately give them a higher death rate. So when all this is over, and as we've said, it will end, we will get over coronavirus, but there will still be health disparities, which we really do need to address in the African American community. Thanks.
Well said.